there's a group in town that's called our First Steps program, and it's a business that's led by business leaders and foundation people and local folks that are interested. They're leaders in our community that are interested in helping. Basically, the 0 to 5 population was their focus, and they chose the CHAP program that we designed as one of the things that they would support and gain funding from foundations. So that's where the funding came from originally, and it also came from a significant commitment from our managed care Medicaid plan that gave us these 15,000 kids to help manage with them, and they provided not just increased reimbursement, so some of our doctors would take these kids in their offices where they weren't before, but also pay for performance things where if they helped manage them better, kept them out of the ER, got them into their office more efficiently, they got paid an incentive for that also. It's taken a couple things. One, usually a pediatrician catches on and wants to lead it, and that's been the most exciting part. When I learned this from a pediatrician at Denver Children's Hospital, I'm a pediatrician, and all the ones who have really initiated this have been a pediatrician who's really a community advocate in those areas. So I would say the number one thing is you get a pediatrician who really wants to, because these aren't our jobs. We do these on the side because we really love helping the community piece, and there are a lot of pediatricians that are looking for things like that to do. So I would say that would be one. The second one is to have some connections with some local business leaders. What they did in Kalamazoo was the pediatrician got it going, came to us, we came down, presented. They pulled people together and invited them for a big presentation for an hour. Then we showed them what we did. You had health plan people there, you had business leaders, you had administrative leaders from the hospitals, you had people from the community came to hear. And then some of them afterwards would say, okay, yes, I'd like to do this. And that's basically how it happened in Grand Rapids. Our person came from Denver Children's. We had a number of people called together. He presented the program they did, and the health plan chief medical officer stood up right after that to me and said, I want to do this. So that's kind of how you have to do it. We come down, we can do presentations, you get the right people together, usually a pediatrician that's kind of bring them together because they're the ones who really kind of need to lead it, and then we can come and present, or we have a toolkit that people can use, and then you pretty much pick out the other leaders in the community that might want to take something like this on.
Reporting for Global Medical News Network, I'm Sherry Bosher.